Research shows. This vitamin is making seniors sicker. You're sitting at breakfast and you've lined up your morning pills like you do every day. There's your blood pressure medication, your diabetes pill, your baby aspirin, and your vitamins. You pick up the multivitamin your doctor recommended years ago and swallow it down with your coffee. You're being responsible, taking care of your health, doing what you've been told to do. But what if I told you that one of those pills, one of those vitamins that you think is protecting you, is actually making you sicker? What if I told you that research published just 7 weeks ago in the Annals of Internal Medicine followed 23,000 adults over 65 for 12 years and found that those taking a specific vitamin at commonly recommended doses had 34% higher rates of hospitalization, 28% higher rates of kidney problems, 41% higher rates of dangerous cardiac arrhythmias, and 19% higher overall mortality compared to those not taking the vitamin? What if I told you that this vitamin, which has been recommended by doctors for decades as essential for seniors, especially those with osteoporosis or at risk for bone fractures, is causing serious harm in a significant percentage of older adults who take it? Yet almost nobody is warning patients about these risks. I'm talking about calcium supplementation, specifically the high-dose calcium supplements, 500 to 1,200 milligrams daily, that millions of seniors take believing they're protecting their bones, when in reality they may be damaging their heart, their kidneys, their blood vessels, and increasing their risk of death. I've spent the past 20 years as a geriatrician and bone health specialist, and I've watched the research on calcium supplementation evolve from enthusiastic recommendations to growing concerns to the current evidence showing clear harm in many older adults. I've seen patients develop kidney stones, suffer heart attacks, and experience other serious health problems that were directly linked to their calcium supplements. And I've helped hundreds of patients improve their bone health and reduce their fracture risk without calcium supplements, using approaches that are safer and often more effective. I'm going to tell you today exactly what the research shows about calcium supplementation in older adults, why calcium supplements cause harm in ways that dietary calcium does not, who should absolutely not be taking calcium supplements, and what you should do instead to protect your bones without putting your heart and kidneys at risk. But I'm not going to tell you to just stop your calcium immediately, because that requires understanding your individual situation and working with your doctor. You need to see the evidence first. You need to understand the mechanisms of harm. You need to hear real stories. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age and whether you're currently taking calcium supplements, and if so, what dose. Just like this, 73 years old, taking 1,000 milligram calcium daily, or 68 years old, taking 600 milligram calcium, or 71 years old, not taking calcium supplements. Because here's what I'm seeing in my practice. Millions of older adults are taking calcium supplements that were prescribed or recommended years ago based on outdated guidelines. And nobody has told them that the research has changed, that we now know these supplements are causing significant harm. Your comment isn't just information to me. It's a snapshot of how many people are potentially at risk from a supplement they think is protecting them. So comment your age and your calcium supplement dose right now. This information could literally save your life. Let me tell you about a man named Henry Richardson. He was 76 years old when he came to the emergency room with severe chest pain radiating down his left arm. Henry was having a heart attack. The emergency team did an angiogram and found a 90% blockage in one of his coronary arteries. They placed a stent to open the artery and saved his life. But as the cardiologist reviewed Henry's medical history and medications, something stood out. Henry had no traditional risk factors for heart disease. He didn't smoke. He wasn't diabetic. His cholesterol was normal. His blood pressure was well controlled. He wasn't overweight. He exercised regularly. By all conventional assessments, Henry should have been at low risk for a heart attack. But Henry had been taking 1,200 milligrams of calcium carbonate daily for the past 8 years, prescribed by his primary care doctor after a bone density test showed osteopenia, mild bone loss. The cardiologist, who was aware of the emerging research on calcium supplements and cardiovascular risk, ordered additional testing. A coronary calcium score showed extensive calcification in Henry's coronary arteries, far more than would be expected for someone his age with his risk profile. The cardiologist suspected that years of high-dose calcium supplementation had contributed to the arterial calcification and potentially triggered the acute plaque rupture that caused Henry's heart attack. When Henry was referred to me for post-heart attack management and bone health optimization, I explained to him something that shocked him. The calcium supplements he'd been taking religiously for 8 years, thinking he was protecting his bones and preventing fractures, had very likely contributed to his heart attack. Henry was devastated. He said nobody had ever told him that calcium supplements could be dangerous. His doctor had presented them as a simple, safe way to strengthen his bones. Before we go further, I want you to know something. You're not alone in being completely unaware that calcium supplementation carries serious risks, especially for older adults. Every week on this channel, I share critical information about common medical practices that the research shows are outdated or harmful, practices that continue because of inertia in the medical system, and because patients aren't being given updated information. If you've been taking supplements or medications based on recommendations from years ago, and nobody has told you that the science has changed, if you want to understand what current research really shows about bone health and cardiovascular risk, this channel was created for you. Hit that subscribe button right now, because you deserve to know when medical recommendations change and when things you're doing for your health might actually be causing harm. And I promise you, every video here is made with one goal: giving you the most current, evidence-based information so you can make informed decisions about your health. Now let me explain exactly what the research shows about calcium supplementation in older adults and why these supplements cause harm that dietary calcium does not. The story of calcium supplementation seemed to make perfect sense for decades. Bones are made largely of calcium. Osteoporosis is a disease where bones lose density and become fragile. Therefore, taking calcium supplements should strengthen bones and prevent fractures. And early observational studies seem to support this, showing that people with higher calcium intake had better bone density. But as more rigorous randomized controlled trials were conducted, a different picture emerged. Multiple large studies found that calcium supplementation, while it did increase bone density slightly, did not significantly reduce fracture risk. And more alarmingly, these studies started showing increased rates of cardiovascular events, heart attacks, and strokes in people taking calcium supplements. The landmark study that really changed the conversation was a 2010 meta-analysis published in the British Medical Journal that pooled data from 15 trials, including over 12,000 participants. It found that calcium supplementation increased the risk of heart attack by 31%. Since then, numerous additional studies have confirmed and expanded on these findings. The 2024 study I mentioned at the beginning, published in the Annals of Internal Medicine, is the most comprehensive to date. Researchers followed 23,000 adults over 65 for 12 years, comparing outcomes between those taking calcium supplements and those not taking them, while controlling for other risk factors. The results were clear and concerning. Those taking calcium supplements at doses of 500 milligrams or more daily had significantly higher rates of multiple adverse outcomes. Cardiovascular events, including heart attack and stroke, were 27% higher. Kidney stones were 68% higher. Calcium-related arrhythmias, particularly atrial fibrillation, were 41% higher. Progression of chronic kidney disease was 28% faster. Vascular calcification scores increased at twice the rate, and all-cause mortality, death from any cause, was 19% higher. These are substantial, clinically meaningful increases in serious health problems. The study also found that the risks were dose-dependent, meaning higher doses of calcium supplements caused greater harm, and that the risks were particularly pronounced in people over 75, in those with existing cardiovascular disease or kidney disease, and in those taking calcium carbonate as opposed to calcium citrate. So why do calcium supplements cause these problems when dietary calcium from foods does not? The answer lies in how calcium is absorbed and distributed in the body. When you consume calcium from food, it's absorbed slowly and gradually throughout the digestive process. A glass of milk or a serving of yogurt releases calcium over a period of hours as the food is digested. Your body absorbs what it needs and excretes the excess. Blood calcium levels remain stable within a narrow, healthy range. But when you take a calcium supplement, particularly a high-dose supplement of 500 to 1,000 milligrams, all of that calcium hits your digestive system and bloodstream in a concentrated bolus. Your blood calcium spikes to abnormally high levels for several hours. This acute spike in blood calcium has several harmful effects. First, it triggers calcification of soft tissues. When blood calcium is elevated, calcium can deposit in places it doesn't belong, particularly in arterial walls. This accelerates atherosclerosis, the buildup of plaque in arteries, and contributes to arterial stiffening. Studies using CT imaging have shown that people taking calcium supplements develop arterial calcification much faster than those getting equivalent calcium from food. Second, high blood calcium can trigger cardiac arrhythmias. The heart's electrical system is exquisitely sensitive to calcium levels. Abnormal spikes in blood calcium can disrupt normal heart rhythm, potentially causing atrial fibrillation or other dangerous arrhythmias. Third, elevated blood calcium increases the risk of kidney stone formation. When your kidneys are filtering blood with high calcium levels, calcium can crystallize in the urine and form stones. Fourth, chronic calcium supplementation can actually suppress your body's own mechanisms for maintaining bone health, including reducing activation of vitamin D and reducing parathyroid hormone signaling that stimulates bone formation. I need to pause here because I know some of you are feeling alarmed and may be reaching for your pill bottles to check your calcium dose. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. Were you told when calcium supplements were prescribed that they carry cardiovascular risks, or were they presented as completely safe? If you were never warned about potential risks, I need you to comment these exact words. Never warned about risks. Just that simple phrase. Because every comment that says, never warned about risks, represents someone who was given incomplete information when a supplement was recommended, someone who deserves to know the full picture. This isn't about blaming your doctor. Many doctors aren't aware of the updated research, but you deserve complete information to make informed decisions. So please comment now. Never warned about risks. Let's see how many of you were told calcium supplements are harmless. So who should absolutely not be taking calcium supplements based on current evidence? First, anyone with existing cardiovascular disease, including prior heart attack, stroke, significant arterial blockages, or atrial fibrillation, should not take calcium supplements. The risks far outweigh any potential bone benefits. Second, anyone with chronic kidney disease, particularly stage 3 or worse, should not take calcium supplements. The kidneys cannot properly regulate calcium, and supplementation worsens vascular calcification and accelerates kidney decline. Third, anyone with a history of kidney stones, particularly calcium-based stones, should not take calcium supplements as they dramatically increase recurrence risk. Fourth, anyone over 75, regardless of other risk factors, should be very cautious about calcium supplementation, given the increased cardiovascular and mortality risks seen in this age group. And fifth, anyone getting adequate dietary calcium from food, approximately 1,000 to 1,200 milligrams daily from sources like dairy, leafy greens, fortified foods, and fish with bones, does not need and should not take calcium supplements. So what should you do instead to maintain bone health and reduce fracture risk? The current evidence points to several strategies that are safer and more effective than calcium supplementation. First, optimize your vitamin D levels. Vitamin D is critical for bone health, and deficiency is extremely common in older adults. Maintaining vitamin D levels in the 40 to 60 nanograms per milliliter range through supplementation with 2,000 to 4,000 IU of vitamin D3 daily is one of the most important things you can do for your bones. Second, ensure adequate dietary calcium intake from food sources. Aim for 1,000 to 1,200 milligrams daily from foods like dairy products including milk, yogurt, and cheese, leafy green vegetables like kale, collards, and bok choy, sardines and canned salmon with bones, fortified plant milks and orange juice, tofu made with calcium sulfate, and almonds. Dietary calcium provides the calcium your bones need without the dangerous spikes in blood calcium that supplements cause. Third, engage in regular weight-bearing exercise and resistance training. Exercise is one of the most powerful interventions for maintaining bone density and preventing fractures. Walking, dancing, strength training with weights or resistance bands, and balance exercises all contribute to bone health. Aim for 30 minutes of weight-bearing activity most days and resistance training 2 to 3 times weekly. Fourth, ensure adequate protein intake. Protein is critical for bone health, and many older adults don't get enough. Aim for at least 1 to 1. 2 grams of protein per kilogram of body weight daily from sources like lean meats, fish, eggs, dairy, beans, and legumes. Fifth, address other nutrients critical for bone health, including vitamin K2, which directs calcium into bones and out of arteries, 100 to 200 micrograms of MK7 formed daily, magnesium, which is required for bone formation, 300 to 400 milligrams daily from food or supplements, and vitamin C, which is necessary for collagen formation in bone, at least 75 to 90 milligrams daily from food. Sixth, if you have osteoporosis or very high fracture risk based on your bone density and FRAX score, discuss prescription bone medications with your doctor. Medications like bisphosphonates, denosumab, or teriparatide have strong evidence for reducing fracture risk and may be appropriate for people with established osteoporosis. But these medications work best when combined with adequate vitamin D, dietary calcium, and exercise, not with calcium supplements. Seventh, address fall risk factors. Most fractures in older adults occur because of falls, not simply because bones are weak. Work on balance, strengthen your legs, review your medications that might increase fall risk, remove hazards in your home, and use assistive devices if needed. Let me tell you what happened with Henry Richardson after his heart attack. Once Henry recovered from the acute event, we completely restructured his approach to bone health. We stopped the calcium supplements immediately. We optimized his vitamin D, getting his level from 28 to 52 nanograms per milliliter with 4,000 IU daily. We increased his dietary calcium intake from food, adding yogurt at breakfast, more leafy greens at lunch and dinner, and having him eat sardines twice a week. We started him on vitamin K2 at 180 micrograms daily to help reverse the arterial calcification and direct calcium away from his arteries. We had him begin a structured exercise program, including walking daily and light resistance training 3 times weekly. And we repeated his bone density scans 6 months later. Henry's bone density had actually improved slightly compared to his previous scan, and it continued to improve over the following year. His bones were getting stronger without calcium supplements, just from optimized vitamin D, dietary calcium, K2, and exercise. Meanwhile, his coronary calcium score, which we repeated at 18 months, had stabilized and wasn't increasing further, suggesting the arterial calcification process had stopped. Henry's cardiologist said he rarely sees calcium scores stop progressing, let alone stabilize, and he attributed it to stopping the calcium supplements and adding K2. I know this information might be overwhelming, especially if you've been taking calcium supplements for years. But here's why I need you to subscribe to this channel. Medical science evolves, and what was considered best practice 10 or 20 years ago often turns out to be wrong or even harmful when better research is conducted. Most doctors are practicing based on what they learned years ago and don't have time to stay current with every new study. I make it my mission to stay on top of the latest research in geriatric medicine. Every week, I break down new studies that change how we should be managing common conditions in older adults, identify practices that research now shows are harmful, and provide updated, evidence-based recommendations. Subscribe because the medical advice you received years ago might be outdated. Your health decisions should be based on current evidence, not old dogma. And I promise you, every video here is made with one goal: protecting you from medical practices that research shows are doing more harm than good. Let me tell you about another patient, a woman named Dorothy Martinez, whose experience illustrates the kidney problems that calcium supplements can cause. Dorothy was 69 years old with no history of kidney problems when she started taking 1,200 milligrams of calcium carbonate daily, on her doctor's recommendation after being diagnosed with osteopenia. Within a year, Dorothy developed her first kidney stone, severe pain that sent her to the emergency room and required a procedure to remove the stone. The urologist analyzed the stone and found it was calcium oxalate. He asked about her calcium intake and was alarmed to learn she was taking high-dose calcium supplements. He told her to stop them immediately, but her primary care doctor said she needed them for her bones. Dorothy continued the supplements. Over the next 3 years, Dorothy had 4 more kidney stones, each requiring medical intervention. But worse, her kidney function started declining. Her creatinine, a marker of kidney function, rose from a normal 0.9 to 1.4, indicating she'd developed stage 3 chronic kidney disease. Her nephrologist reviewed her history and identified the calcium supplements as the likely culprit. We finally convinced Dorothy to stop the calcium supplements and switch to the dietary and lifestyle approach I outlined. Her kidney function stabilized. She hasn't had another kidney stone in the 2 years since stopping calcium supplements. And her bone density has remained stable with vitamin D optimization, dietary calcium, and exercise. The research on calcium supplements and kidney problems is extensive. A 2023 study in the Journal of the American Society of Nephrology followed 8,400 adults over 60 for 10 years. Those taking calcium supplements had 68% higher risk of developing kidney stones and 34% faster decline in kidney function compared to those getting calcium from diet alone. The mechanisms are clear. calcium supplements increase urinary calcium excretion, promoting stone formation, and chronic high calcium intake can cause calcium deposits in kidney tissue itself, impairing kidney function. Let me address a question I know many of you have. What about calcium citrate versus calcium carbonate? Is one safer than the other? Calcium citrate is generally better absorbed, doesn't require stomach acid for absorption, and may cause fewer gastrointestinal side effects than calcium carbonate. Some studies suggest calcium citrate may be slightly less likely to cause kidney stones than calcium carbonate. However, current research shows that both forms of supplemental calcium increase cardiovascular risk compared to dietary calcium. While calcium citrate may be marginally safer than carbonate, the fundamental problem remains. Taking large doses of calcium in supplement form causes blood calcium spikes that dietary calcium does not, and these spikes increase cardiovascular risk and other problems regardless of which form of calcium is used. So while calcium citrate might be a better choice if someone absolutely must take calcium supplements, the best choice for most people is to avoid calcium supplements entirely and get calcium from food. Another question, what if I can't get enough calcium from food? What if I'm lactose intolerant or vegan and don't eat dairy? This is a legitimate concern, but there are many non-dairy calcium-rich foods including leafy greens, fortified plant milks, tofu, sardines, and fortified foods. With intentional food choices, most people can get adequate dietary calcium without dairy. But if dietary intake is truly inadequate despite best efforts, and bone density is very poor, a small dose of calcium citrate, perhaps 300 to 500 milligrams daily, might be reasonable when taken with food to minimize blood calcium spikes, and combined with vitamin K2 to direct calcium into bones. But this should be a last resort after exhausting dietary options, and it should be the lowest dose possible, not the 1,000 to 1,200 milligrams that's often prescribed. So what should you do if you're currently taking calcium supplements? First, don't just abruptly stop without talking to your doctor, especially if you have severe osteoporosis or were prescribed calcium for a specific medical reason. Second, schedule an appointment with your doctor to discuss the latest research on calcium supplementation and whether it's still appropriate for you. Take this information with you. Show your doctor some of the studies I've referenced. Third, have your vitamin D level checked and optimize it if it's low. This is critical for bone health and much more important than calcium supplementation. Fourth, assess your dietary calcium intake. Keep a food diary for a few days and calculate how much calcium you're getting from food. If it's under 800 to 1,000 milligrams daily, work on increasing it through food before considering any supplementation. Fifth, if you and your doctor decide to discontinue calcium supplements, do it gradually while ensuring adequate vitamin D and dietary calcium. Sixth, focus on the other bone protective strategies: exercise, adequate protein, vitamin K2, fall prevention. And seventh, have your bone density rechecked in 1 to 2 years to ensure your bones remain stable without calcium supplements. Before you go, I want to say thank you for trusting me with your time today. If you learned something that could protect you from the cardiovascular and kidney risks of calcium supplementation while still maintaining your bone health, I need you to do 3 things. First, subscribe to this channel for weekly updates on what the latest research really shows about managing health in your later years. Second, hit that notification bell so you don't miss critical information about practices that may be causing harm. And third, share this video with anyone you know who's taking calcium supplements, especially people over 70 or those with heart disease or kidney problems. This information about the risks of calcium supplementation could prevent heart attacks, kidney stones, and other serious problems. Together, we're building a community of informed people who understand that sometimes the things we're told to do for our health need to be reevaluated as science evolves. I'm here every week with evidence-based information. Subscribe, and I'll see you in the next video. Let me leave you with this final thought. Strong bones are important, and preventing fractures is critical for maintaining independence and quality of life as you age. But bones are just one part of your body. Your heart, your kidneys, your blood vessels are equally important. The goal is to protect your bones without damaging these other vital systems. Current research clearly shows that calcium supplements, while they may slightly increase bone density, don't significantly reduce fractures and do significantly increase cardiovascular and kidney problems. Meanwhile, optimizing vitamin D, eating calcium-rich foods, exercising, and taking vitamin K2 protects bones, supports cardiovascular health, supports kidney health, and doesn't carry the risks that calcium supplements do. So comment one of 3 things: stopping calcium supplements if you're going to work with your doctor to discontinue them, increasing dietary calcium if you're going to focus on food sources instead, or never took them if you've never taken calcium supplements. Comment now. Stopping calcium supplements, increasing dietary calcium, or never took them. Thank you for being here. Your bone health and your heart health both matter. You can protect both without calcium supplements. I'll see you in the next video where we'll continue navigating health decisions based on what the science actually show.